My name is Kay Hewson. I'm the Director of the Australian Teletrial Program. I work in the Office of Research and Innovation in Queensland Health as the proud host of the Australian Teletrial Program. The Australian Teletrial Program is a $75.2 million enabling infrastructure grant under the Medical Research Future Funds to help build capacity and capability of clinical trials into regional, rural and remote areas of Australia, accessing new treatments and therapies for all patients. The program started in 2021. It was on the back of a pilot that was run through oncology, through the Clinical Oncology Society of Australia, across 3 jurisdictions, so New South Wales, Victoria and Queensland. It had a very strong following at that time, and the jurisdictions came together to put in an application and lobby the MRFF to be able to do this first time enabling grant. The aims of the program was simply that we needed to have access to new treatments and therapies to lift the standard of care in regional, rural and remote parts of Australia, enabling health equity and making sure that patients wherever they live are aware of their opportunities to participate in a clinical trial. And for our clinicians to be able to offer and still have research as part of their roles if they choose or they live in a regional, rural and remote area of Australia.
I'm Melanie Potson, the Assistant Director of Nursing of the Queensland Regional Clinical Trial Coordinating Centre. Our remit is to deliver clinical trials via teletrial to the rural, regional and remote patients of Queensland. Townsville has a population of around 200,000 people. It's a large health service. It goes north to Cairns, west to Mount Isa, south to Mackay, and is a tertiary level university hospital, providing a whole range of services to not only people in Townsville but across the whole health service district. What we have today and the developments that we have has been built on that success really of those pilot sites, but in particular Townsville Hospital and Health Service, where everybody at all levels has got behind the programme and sees the benefit of rural, regional and remote patients having this access and understands that, you know, it can deliver better health outcomes and better quality of life. So really exciting, and you know, Townsville Hospital and Health Service is a leader nationally and now becoming international in this field of teletrials. Clinical trials have typically been delivered to metropolitan and larger regional centres only. Since the teletrial model, we've been able to expand into the rural, regional and remote and actually have trial activity now in all of the 16 hospital and health services in Queensland. There's a whole list of new disciplines that are now able to offer new treatments through clinical trials via the teletrial model and the connections and the networks. Good clinicians want to be able to deliver more than what they can currently offer as a standard of care. So access to a clinical trial gives them the option of something at least equal to, but thought to be a lot better than what we can currently offer for a diagnosis of cancer or disease. The benefits for the patients themselves are actually having the opportunity to have access to a clinical trial via teletrial, having the option of a better treatment option that might save their life, might make them live a lot longer, might just bring a lot more quality to the life that they have. These are the benefits of them having access to clinical trials via teletrials.
In 2022, 6 jurisdictions came together: South Australia, Western Australia, Northern Territory, Queensland, Tasmania and Victoria to partner in this program, working collaboratively to make sure that they had a standardised approach to bringing clinical trials into regional, rural and parts of Australia. How that works now is that we work across 5 governments and Western Australia Country Service to make sure that we support each other and have programs of intent around harmonization, education and training, recruitment boosting activities, so some incentive payments, but also working to look at ways to build our awareness and our communication and engagement for the program, to provide leadership in all of those jurisdictions to our sites being the emphasis of the program in the capacity and capability building, and also being able to work with commercial sponsors and clinicians and consumers to advise and support us and guide us what is the community need for the program in those different jurisdictions, and again, where possible, to really promote and show that as a country, Australia is open for clinical trials, for investment, but also for our collaborative researchers to be able to partake in research wherever they live.
My name is Heather Parker and I'm the Program Manager for the Australian Teletrial Program in the Northern Territory. We have some unique characteristics here that you don't see in any other state in Australia. So we've got very large geographical distances, very remote communities. So in that MM3, MM7 category, we've got a lot of communities here that are that very remote MM7 category. We have a 30% Aboriginal or Torres Strait Islander population in the Northern Territory. And while that population is 30%, in the public health system, the Aboriginal and Torres Strait Islander population represents 70% of the population within the public health system. We have a lot of chronic disease issues in the Northern Territory, and some of those very remote areas as well. There's very limited phone reception, very limited internet access, and so we do have some very unique things in the territory here. As well as that, we also have some pretty severe workforce shortages across all areas in healthcare. So that includes medical, nursing, pharmacy, pathology, and allied health. So trying to keep clinical trials in that space is quite a unique opportunity, and that's where the Australian Teletrial Program really comes into play. We've got a lot of broad range of trials there, and some of these specialty areas have never actually conducted clinical trials in the Northern Territory. So we're really expanding that capacity and capability for conducting clinical trials in the Territory, which is really exciting. Some of these participants have been enrolled from really remote areas like Tennant Creek, Tea Tree, Hermansburg, and also just to show the specialty and capacity for conducting clinical trials. A couple of our clinical trials have actually been conducted from Alice Springs, and they've been acting as the primary site. So that's the main site to be conducting clinical trials, which is really exciting for Alice Springs.
I'm really excited to tell you that we have a proven program now outside of oncology. Oncology still being very important, but into other clinical specialties, respiratory, cardiac, diabetes, sexual health, mental health, all areas where we see there's a gap in service and equity in those regional, rural, and remote places. We have adults and paediatrics involved in the program. We're able to tell you that we have a higher than the national average participation rate of clinical trials by First Nations peoples in satellite locations. We can see that we're saving time, money, and distance for those patients to satellite sites. We've got over 1,000 participants in teletrials across the 6 jurisdictions. We have a very collaborative and supportive mechanism and network around education and training.
The Australian Teletrial Program is really important because it acts as a network or linking service between, say, our tertiary hospitals like Royal Darwin Hospital, our health clinics out in more rural and remote areas, our GP clinics, and all of those different health services, and it links that into specialists who might act as principal investigators for a clinical trial, and we can link those in with sponsors who are interested in running these trials in the Northern Territory, and then we can liaise with people, get everyone online or in a room together, virtually in a room together, to discuss the feasibility of these trials. And this is what the Teletrial Program does. So we link everyone together, and so we can discuss how this trial is going to run, what's going to work for the Territory, and really talk about those unique characteristics of the Territory to make sure these trials are successful.
We support the program to be standardised through a harmonization activities. Those harmonization activities have really evolved out of looking at what are the implementation tools that we need to actually support those sites. So for one example would be a national supervision plan. That supports the peer-to-peer support at site. It supports the roles and responsibilities the service level that's offered at those sites, but it also gives confidence to our collaborative sponsors, our commercial sponsors, to know that those sites are well supported and communicate well, which is the crux of the Australian Teletrials model, and the telehealth part is telecommunication, so that they have that constant evolving monitoring, quality assurance, as well as the startup activities that happen. At a national level, we have seen that these implementation tools are actually part of our education as well, back to ethics and research governance, but also some of the other peak bodies like the National Health Medical Research Fund, etc., MRFF. And out of the national policy now is the one-stop shop. And we have that very clear sight for them through our executive committee. Our governance has a crossover into that one-stop shop intergovernment policy reform group. So we're able to keep them informed of where we're evolving to and what our need is, but also to be part of their implementation, because we can be the implementation teams. That's what we do, and we're doing it well together. This is a big change, transformational program. It's starting a movement. It is not just a little, we're starting a program. It's a movement. It's transformational. And that with that comes lots of challenges. And taking people with you on the journey takes time to build up those relationships and trust. In the jurisdictions as well, they're coming from different base levels. So we talked about the pilot, but 4 of those jurisdictions had no clinical trial activity outside of a metro area. So it takes time to build that infrastructure and to onboard your workforce. And that is evolving now. We can see that has made a difference. So we should not underestimate the work that goes on in the background of an infrastructure grant that then people might judge us on is actual numbers. And even though we're proud of those numbers coming through, the labour and the intensity and the resource that has gone into building that initial infrastructure through the regional clinical trial coordinating centres, getting the right skill sets in place, getting the passion, harnessing that passion to get their jurisdictions on board. The plans for Australian Teletrial Program going forward beyond 2026 is to work collaboratively with New South Wales ACT, Revitalise, Alfred Trial Hub, all of our jurisdictional partners, to make sure we are very much a national program building research, further research into regional, rural and remote areas. We have a lens on sustainability. That's why we have an evaluation going on. But it also means that as a complete national program, we're looking at where we can bring in investment, where we can support workforce, where we look at what are the strengths of each jurisdiction to build on as well, and for the lessons learned through this program. So we're already getting the attention of government, our own, in each jurisdiction, but also the Commonwealth, to say that, there will be patients still on clinical trials, there will be workforce employed, and there is a strong need coming through from those communities to say this program needs to be here for ever, and we are part of building that sustainability to get the attention to be able to take that forward.